Hello, my name is Wang, and I'm a nephrology fellow at the University of Washington. On behalf of my co-authors, I'm excited to present a summary of our manuscript published in CJASN titled Alteration of High-Density Lipoprotein Composition with Hemodialysis Initiation. Dyslipidemia is a strong risk factor for cardiovascular mortality in maintenance dialysis patients. Lipid abnormalities in dialysis patients include increase in triglycerides and reduction in high-density lipoprotein, or HDL cholesterol. HDL particles transport excess cholesterol from peripheral tissues to the liver for disposal in bile and have known anti-inflammatory and antioxidant functions. Several studies have demonstrated functional impairment of HDL particles obtained from maintenance dialysis patients compared to healthy individuals. However, these findings do not distinguish the potential impact of uremia from hemodialysis, both of which may promote pro-inflammatory pathways. We designed a study to assess the effect of hemodialysis initiation on HDL protein composition and cholesterol efflux capacity in individuals with advanced CKD. We studied 110 participants with advanced CKD and 142 patients initiated on hemodialysis within the previous year. We compared relative differences in 38 HDL-associated proteins in incident dialysis patients to those with advanced CKD. We also compared differences in cholesterol efflux between the two groups in a subset of 80 participants. We found that dialysis initiation was associated with elevated concentrations of 8 HDL-associated proteins, including serum amyloid A1, A2, and A4, hemoglobin beta, haptoglobin-related protein, cholesterol ester transfer protein, phospholipid transfer protein, and apolipoprotein E. These proteins are known mediators of inflammatory, lipid metabolism, and thrombosis pathways. We think that this is an important finding because we have demonstrated that hemodialysis may independently provoke changes in the HDL particle that are not present in late-stage CKD. Thank you for listening to this CJASN podcast.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.